Welcome to the deep dive. Today we're really getting into something significant, how Magic Johnson's fight against HIV really shifted public understanding.
Yeah, it's a powerful story. We're drawing from the Legacy of Hope, looking at the summary, and, well, a good chunk of the chapters, 1 through 19.
Right. Our mission here is to explore how this huge sports icon ended up reshaping how we all saw HIV's, driving awareness.
And for you listening, it's a fascinating look at, the power one person can have. Some surprising insights, I think.
Definitely. Let's dive into Chapter 1, November 7th, 1991. That press conference. The atmosphere must have been intense.
Oh, absolutely. You had this anticipation, but also this heaviness. Magic wasn't his usual beaming self. Composed, yes, but grave.
And then the announcement HIV positive, retiring. Shock.
A total shock and disbelief. He was the picture of health, right? It just shattered every stereotype about who this virus could affect.
Instantly. And he immediately said he'd be a spokesperson.
Yeah, committed right then and there. The news just exploded. Wildfire doesn't even cover it.
What were the initial reactions like, beyond the fans' devastation?
Well, you had the media frenzy, obviously. The NBA was stunned supportive, yes. But you could feel the underlying fear, too. That reflected the wider societal stigma, really.
So his announcement wasn't just personal news, it was a catalyst.
Absolutely. It forced a national conversation, a call to action almost.
Okay, let's step back slightly. Chapter 2, A Star's Rise and a Sudden Halt. Remind us about his career before 91.
I mean, legendary, right? From Lansing, Michigan, becoming Magic in high school, the NCAA title against Bird, then LA Showtime.
Multiple championships, MVPs.
Yeah,
He was more than just a player, a cultural icon.
exactly. So the 91 diagnosis wasn't just a career halt, it was seismic. The retirement was heartbreaking, left this huge hole in the NBA.
But that void, as you said, sparked dialogue.
Yeah, it broke down barriers. And Magic, well, he channeled all that energy, that drive, straight into advocacy and education. A whole new game plan.
Which leads us right into Chapter 3, confronting the stigma. Because back then, the stigma was intense.
Oh, incredibly pervasive. HIV/AIDS was deeply associated with marginalized groups. So much misinformation, so much fear.
Magic must have known disclosing his status was a massive risk.
For sure. But doing it was a watershed moment. It put a human face, a beloved face on the disease, challenging those fears directly.
How did he start educating people?
Early efforts were multifaceted, lots of media, TV appearances, those public service announcements, working with health organizations.
Trying to break that us versus them idea.
Precisely, hammering home that HIV doesn't care who you are. He got praise, sure, but also resistance. His persistence, though, driven by empathy, was key.
And that persistence led to the Magic Johnson Foundation, right? Chapter 10.
Exactly. It wasn't just talk, he wanted tangible impact. The foundation tackled the misinformation, the stigma head on.
What was the core mission early on?
Education, awareness, and crucially support for those affected. They built partnerships, medicine, education, community groups.
I remember hearing about mobile testing units.
Yeah, big initiative, taking testing into underserved communities, and Magic himself would often show up, which was huge. Plus, a strong focus on youth education.
That celebrity factor, as Chapter 13 explores, was powerful.
Immensely. He used that status strategically. Think about appearances on shows like Arsenio Hall, news programs, sharing his story, educating millions.
And collaborations, too.
Yes, with Elton John on fundraising, fellow athletes for PSAs, even Muhammad Ali, reaching different audiences, especially youth.
Did it demonstrably change public awareness?
Studies showed it did. Increased knowledge, definitely decreased stigma, and it inspired countless others to volunteer, donate, educate in their own communities.
Moving on to the policy side, Chapter 16 and 17. He didn't just raise awareness, he pushed for systemic change in healthcare.
Right, he navigated healthcare policy, worked to break down barriers to care, built coalitions with healthcare groups, experts,
Partnering with the NIH, advocating for research funding.
and working with grassroots groups providing direct care. His support was critical in championing the Ryan White Care Act.
Which provided vital funding.
Absolutely essential. And he looked globally, too, working with the WHO and UNAIDS.
And the media's role evolved too, didn't it? From potentially fueling stigma to becoming a tool.
Initially, yeah, coverage reflected the fear. But Magic used interviews, documentaries like The Announcement, talk shows Oprah, 60-minute publications, digital media, very strategically to educate and humanize the issue.
So bring us towards the present, Chapters 18 and 19 talk about the ongoing legacy.
The foundation is still very active, funding programs, providing resources, still advocating for policy change and research.
What are some recent examples?
Things like access for all, focusing on affordable medication, and safe spaces for community support. They're using Tech 2 apps, social media campaigns.
And investing in the next generation.
Yeah, the Leaders of Tomorrow program, mentoring young advocates. It's about ensuring the fight continues effectively.
So, wrapping this up, Magic's announcement was clearly more than just a sports moment. It forced a global conversation about HIV/AIDS.
Totally. And his relentless work afterward. The foundation, using his influence, policy engagement, media, it fundamentally changed things. Better understanding, better treatment access.
And for you listening, it's a powerful story about using your platform, whatever it is, for real social change. Courage, empathy, action.
Exactly. It makes you think, doesn't it? Magic leveraged his unique position. What influence do you have in your own life, your own circles? How could you maybe use that to challenge stigma or push for progress on something that matters? Just the thought to consider.
Welcome to the Deep